Today's report says short calls are on the increase across England. 60% of councils that responded commissioned some 15-minute calls. That's a rise of 15% in 5 years. In the most extreme cases, some councils buy 3/4 of all home care in 15-minute slots.
Morning.
But the majority of visits are longer. Rowena Newbury never sees someone for less than half an hour. That's a policy of the provider she works for. She says that gives carers long enough to do the job properly.
They really need some time. They need to feel you can help and that you care about what's happening to them, what they need. And they need to be treated with kindness and clarity and patience.
Whilst the government and most local authorities share the view that 15 minutes isn't long enough to help with most everyday tasks, some councils say shorter visits can be useful if the purpose is just to check someone's okay or that they've had their medication. And many councils say they'd like to promise longer visits, but are facing the twin pressures of cuts in government funding and increasing demand for care as the population gets older.
Because of the financial position nationally, local authorities are actually having less money over the next 2-3 year period to provide care for people. And that's in the context that actually we're having to serve more people and costs are rising. And so there's going to be a squeeze.
Campaigners say many home visits are too close together and care is often not paid between jobs. But ministers say their reforms will improve the quality of the care system and make the money go further.
We've got a significant amount of money that we're spending on health and social care, but we're not spending it in the most effective way. And I think if we can bring the two systems together, and we're requiring that by way of pooling the funds from the NHS and from social care, I think we can achieve a much better use of the resources and achieve better care for people.
The government's big idea is for care budgets to be personalised, so the individual or their family can decide what sort of support they get and when they get it. But for now, some like Betty Henry have little choice but to accept the care they're given. Mike Sargent, BBC News.